Hi, I'm Dr. Lily Lee, and we've invited the cameras today to come in and give you an inside look of what it's like to be inside a plastic surgery office here in Palm Desert. So come along, follow me. This is our front desk where you check in and check out. And moving forward here, so this is our medical grade spa where we have all kinds of medical grade aesthetics that are non-surgical. And this is the medical corridor where we generally divide our procedures between above the shoulders and below the shoulders. So body work usually goes in this room over here, and this room over here is where I do most of the face and eyelid work.
So we've been coming out to the desert on again, off again for about 15 years, but about 5 years ago the opportunity presented itself to take over this practice here on El Paseo, and I decided to go all in, put both feet in and open a practice of plastic surgery here. And so we're full service. We are a full service med spa. We do everything from medical grade facials to Botox and filler injections, to laser and ultherapy treatments, and to what I do and love most is actual plastic surgery. So the scope of my practice really goes from head to toe. I do brow lifts. I'm well known for eyes, and I'm very comfortable doing eyelids surgery. That's really how I got my start. My husband is an ophthalmologist, and I got a lot of referrals doing eyelids, and eyelids then became facelifts and neck lifts. I love doing earlobes. I joke that I like to do things in pairs, so eyes, ears, and naturally being a woman, I do a lot of breast augmentation, breast reduction, and breast reconstruction surgery. And I think tummy tuck to some degree is very much a reconstructive surgery, winding back time prior to pregnancy days to youthful age days. Mommy makeover now is a really popular term, and when a patient comes in or a client comes in and circles mommy makeover on their intake paperwork, I always ask, well, what does that mean to you? And you'd be amazed at the depth of what that means to different people. Some people think it just means a breast lift. Some people think that's everything from a facelift to eye lift to possibly even sometimes rejuvenating their knees. They would just want to look better in a bathing suit. They just want to look like they were the way their body looked before their mommy days. So I often joke that I took the scenic route when it came to training. I spent 10 years at USC, at the University of Southern California. I started in general surgery. I originally thought that I wanted to do burn surgical work and helping burn victims. And I still do very much enjoy burn reconstruction work. But that led to my realization that I really like visual work. So there comes a time when every client who walks through this door becomes a surgical candidate. There's only so much we can do with non-surgical intervention. But what is a facelift? I often get asked, what is a facelift? And it's a really good question because it is a very broad term for facial rejuvenation, for surgical facial rejuvenation. It can address everything, literally from the eyes down. In fact, a lot of times they call an upper facelift or a brow lift an upper facelift. Even a brow lift combined with an eyelid surgery, blepharoplasty uppers and lowers can be considered an upper facelift. But usually when I think about a facelift, I think about the mid-face or the lower face and even down to the neck, which is one of the more commonly asked for procedures. And what that means to me is really rejuvenating that jawline, cleaning up that jawline so that it's nice and smooth. You don't have this excess bags from the jowls that disrupt that clean line from your chin all the way back to the angle of the jaw. Cleaning up that jawline, and all that does, it doesn't change your appearance because your bone structure is your bone structure, and there's no reworking of that, and that doesn't change with age, at least very much. And so really what we're doing is just readdressing the soft tissue, reversing the age of time. So the soft tissue has been pulled down with gravity and with age and just with life. And all we do is rework it, and we just bring it back to where it was. So if it's hollow in here, it's probably full down here, and we just bring it back up where it was supposed to be. There's very little reliance on skin with modern day facelifts, and that's because it's a very unnatural and not a very long lasting procedure when you rely on skin. We know from pregnancy that skin is incredibly able to stretch all out and bounce back. And so a facelift that's reliant on skin just to pull it as far back as possible it's not gonna be a long lasting. Two or 3 years and it'll be back. And so the best facelift in my mind for the most natural looking appearance for just a rejuvenation or a rewinding the hands of time is really just to rework the SMAS layer or the fibrofatty layers underneath the skin and then simply redraping the back the skin in a tension-free manner.
My name is Andrea. I work for Dr. Lily Lee. I do a little bit of everything. The number one thing I see weekly is transformations. People come in here with an insecurity, whether they have a red spot, they have a fine line, they want skin tightening. They just really build their confidence by getting these treatments done. And I see it every day that I'm here. Even moms who have 4 kids, they've breastfed, and they're just feeling really bad about themselves and even for their husbands. So they just want that little bit of oomph, that little breast aug to make them more confident when they go to Cabo, when they even go shopping for clothes.
Beauty comes along with happiness. As far as I'm concerned, beauty and happiness, it's an inside job. You have to like who you are on the inside to have it flow through to come out on the outside. If you feel you're beautiful, everybody else is going to look at you and think you're beautiful. If you're happy inside with who you are, so the first thing you have to do is work on loving yourself for who you are. And that's where you get your beauty and your happiness. We all have beauty, and it's just a question of discovering it and coming out with it and letting everybody else see our beauty.
I seem to attract clients that really want just a very natural look. They don't want to look like they've had anything done, and they certainly don't want to look done. They just want to look more youthful. They want to look like a better version of themselves. They want to look the way they did 10, 15 years ago. Facelifting, there's no one good time for anybody to have a facelift. I've done facelifts for clients as young as in their early 40s, and I have done facelifts as old in their late 70s. What really, it just needs to be customized to the amount of aging that has happened and the amount of reworking of that soft tissue. A lot of times with the older clientele, not only have they lost has there been a gravity drag and pull on the lateral or sides of their face, there's a lot of volume loss in the center portion of their face. And that's when fat grafting comes into play, or a lot of fillers can come into play. If we're already in the operating room, my philosophy is why not take fat from somewhere you don't want and go ahead and replace it back into an area where you do need it, such as your temples or in the central portion of your face, like the nasolabial folds and the marionette lines. So I think naturally, being a woman, I do attract a lot of female clientele. And being a mom, I understand very much the joys and the tolls of motherhood and pregnancy and breastfeeding. I have a lot of clients that come to me for breast work, either for rejuvenation of what used to be, or they come to me for augmentation, wishing for a size that they wish that they had developed into. Sometimes, a lot of times, they're tired of wearing that push-up bra all the time, or being here in the valley. The weather's great for swimming for many, many months of the year, and so they want to be able to be comfortable in a swimming suit, not worry about being padded. While on the subject of mommy makeovers, it always begs the question of a tummy tuck. Tummy tucks, to me, should really be a restoration of the natural tummy. The goal is not to put a scar in the middle of the abdomen that's visible. This is something you want to be able to wear a swimming suit very confidently and not worry about the scars. You want your belly button to look really natural, like nothing was ever done, that you don't want a visible scar in your belly button, which can often be the telltale sign. Recovery for tummy tucks have come a long way. I get a lot of clients that come in and say, am I going to be hunched over for the next 2.5 months? I heard that I can't pick up my kids, I can't drive a car, I can't do this and that. We now do drainless tummy tucks, which have really cut down on downtime. Patients are are able to be more mobile after surgery. And they are less worried about seroma, having to be dealing with these drains that are not only uncomfortable, but also very unwieldy, and worried about having to shower after surgery with a drain in place. When I talk about a tummy tuck, my medical term for it is actually a lipo-abdominoplasty. And the lipo is that I almost always add a little bit of liposuction in both the center to etch out that nice central line to define that almost the hint of a six-pack without looking like it's been carved in there, and then also carve out a waist. When we pull an abdomen down nice and flat, while it can look beautiful flat, you also want it to look beautiful from all angles, and it needs to have that nice, beautiful silhouette of an hourglass shape to some degree. And so I almost always do quite a bit of liposuction in both the waist. Now, when I'm in there, there's also kind of the natural, patients say, do you really tie up my muscles? And in a sense, yes. And that's, if you look at a six-pack, the fibrous tissue in between all those muscles gets stretched out with pregnancy. And no matter how many sit-ups or how much you work your abdominal muscles, the fibrous tissue has no muscle in it, and so it doesn't go back. So that, once it's been stretched, oftentimes if it won't come back, that needs to be reworked, and that needs to be tightened up, kind of like an internal Spanx or an internal girdle. So how nice would it be to lose the Spanx and be able to wear that little black dress and look like you're in your pre-pregnancy days?
So when patients come in here, they want to look natural. They want to look like they haven't had anything done. And that's the standard of care that we deliver here and what Dr. Lee wants in this practice. And I believe that's all I want to deliver to my patients as well, to make patients look just more lively and well-rested and look like them, not look like somebody else. Just to kind of turn back the time a little bit, maybe take off 5 or 10 years, and it's amazing what a little bit of filler and laser and maybe a little bit of microneedling can do to achieve that with really no downtime at all, which is very amazing.
I've had a few treatments with microneedling with Sean, and I noticed the texture of my skin had changed right away. It was very soft. It just felt fresh. I felt like it had given me that pick-me-up that I was looking for. The next thing that I was thinking about, because I had heard so much about it, was Ultherapy. So I talked to Dr. Lee about that option, as opposed to having fillers in my face, and it worked really, really well for me. I had it done to my face, my eyebrows, under my eyes, my chin, because I can't always have a lot of fillers, so Ultherapy was a great option for me.
When I meet someone at a party or at a cocktail party, a lot of times people look at me and say, what do I need? And I often, it's a tricky question, but usually just for ease, I start from the top and I say, well, what bothers you? And oftentimes, a lot of times people don't know what it is that bothers them, but they say, I feel and then I look tired, and I don't know why. And I think oftentimes the culprit of that is your brows and your eyelids. And it's just amazing how a fairly small surgery with a very quick recovery can really change how someone looks dramatically, but not in a dramatic, oh my goodness, what did you do to yourself way, but just in a, wow, you look rested, you look refreshed, did you get new mascara, are you trying something different? Kind of way. The eyes are often the first place that show the aging process. It certainly is the first place you look when you meet somebody. You want to look someone in the eyes. And so the eyes are a really dramatic thing on your face. The surgery is fairly straightforward. We used to, and our technique has really changed over the years. I probably do between 10 to 15 eyelid procedures a week, both between here and Los Angeles. And that procedure it's fun for me and it's easy to do because the recovery is so quick and patient satisfaction is so high with it. The scars are usually very well hidden. People always heal really well from it. And a lot of times when people worry about, am I not gonna look like myself? Am I gonna look unnatural? Am I gonna look surprised? The answer is almost always no. You're just gonna look like a better version of yourself. You're just going to look like the way you did on your driver's license when you first got it. I often get asked, do I need a brow lift or an eye lift or both? And unfortunately, it's not a one-size-fits-all kind of answer or question. It really depends. For men, there's an acceptable amount of droop in the eyebrows that looks very masculine and can look very aesthetically pleasing. For women, similarly, while you want your eyebrows a little bit higher, it can't be so high that they look surprised. Eyelids can also be tricky in that there really is a finite amount of skin that should and could be taken from the upper eyelids. If we get too aggressive and take too much, you have trouble closing your eyes, and that is actually very detrimental to your eyelid and eye health. What I love about the eyelid lift is that all you have to do is take out just a small amount of skin, and it really is a very measured amount of skin, sometimes a little bit of muscle, and close that down and they look completely refreshed, less tired. I get women say they're more confident, they feel better about themselves, they like looking at the mirror suddenly again, they like applying makeup again.
I think what people love about Dr. Lee are the results. They're very natural results, and that's what people are looking for. They don't want that frozen, unnatural look. They want to look and feel great and natural. Mommy makeovers are definitely the #1 thing that people are ecstatic about after they have it done. I mean, moms are feeling, have a low self-esteem after they've had kids. Things are drooping, they need a tummy tuck, a breast lift, and maybe even a breast augmentation. They absolutely are thrilled with the results, and they just walk out with such a transformation and such a high level of confidence.
So in the past 10 years, the patients actually seem to get younger and younger. And that's because instead of waiting until we need to actually correct the lines that are there, we're preventing them from forming. And this will give people a much more youthful appearance for a longer period of time. So we can give them a natural look where they don't look done and they look like them, not like they've had something done. And that's the whole point of doing this, and is to look natural and not look like you've had anything done. That's kind of like the new wave of injecting now for a lot of injectors. Is we're looking more at doing the cheeks and lifting the jowls and preventing those jowls from even forming, so they don't get to that point where we have to do a lot of corrective work. Some patients do get to the point after a long period of time where, surgery really is kind of an only option for them. And what we want to do is we want to catch them before that so they potentially don't have to have surgery.
So what I love about my practice is that we're full service. They may come in for a blepharoplasty and then I remove a little bit of skin from their eyelids, but then it always begs the question of, well, what about my crow's feet? What about the bags on the underside of my eyes? What about the nasolabial folds? What about my neck and my jawline? And because of that, we have an answer almost for anything and anyone. Whether or not you have any ability for downtime, we can do surgical treatments or non-surgical treatments. Sean, my nurse, is excellent with injectables as well as laser treatments and ultherapy. So what can be done for under the eyes? I get asked that question every day. That people say, I'm so tired of people telling me, oh, long night last night, or a tough night, or why are you looking so tired? Because of those, some people call them fat eyes. And they hate the bulge underneath and they want it to be smooth once again. Sometimes it's genetic, and these are actually younger women who aren't tired. They get plenty of sleep and they're in good health, but because of the bags under their eyes, they look tired. And sometimes once they've been told enough times, why are you tired? They start to wonder, am I really tired? Is there something wrong with me? It's a fairly straightforward procedure. Again, it's a small, if needed, removal of skin. Oftentimes we can do the scarless through the inside of the eyelid. creating no scars at all, no visible scars at all. There's really no one perfect technique for the eyelids. It really depends on what is bothering the client the most. My younger patients who don't have a lot of excess skin, really it's just a bulge under the eye that they don't like, that makes their eyes feel heavy and tired. And that can be done with just a simple small incision from the inside of the eyelid, being a scarless procedure. With a very quick recovery, we either reposition that fat further down into their cheeks or into the tear troughs, or we just remove a small amount of the fat altogether. Now with some of the older clientele who have excess crepiness in their skin, that is also a very straightforward procedure where we make an incision just under the eyelids very carefully, and then make a pocket, skin muscle pocket all the way down, releasing that tear trough. And then just re-draping the skin. It's not an excessive pull. I'm not trying to pull, everything up and higher through the eyelids. It's just an excess trim of the excessive skin, and I call it a re-draping, and that's tension-free, so the scar heals beautifully. Thanks to the internet, many of my patients come in these days and they think they know what they want. They come in, they say, I read about Juvederm and I want Juvederm put right here. And they don't realize that that's not necessarily for everyone. Sometimes Juvederm can be really disastrous. You can end up with a blue sausage across the lower eyelid, which I think looks much worse than, frankly, just a fat bag underneath the eye. Sometimes what they don't need surgery, or sometimes they've had surgery and they want more, and the last thing they need is for more skin to be cut out. What they need is more volume to be placed back in, either with fat or filler. And there's so many different types of fillers now that choosing exactly the correct filler for this under eyelid area where the skin is so incredibly thin and even the smallest mistake can show up is really, really critical. What I like to do with adding volume in the eye is something that depends on if we're going to the operating room already. If we're going to the operating room already, I love using fat. Micro fat droplets is permanent. We place it in very, very carefully, but we're talking micro aliquots, and we're talking smallest drops at a time. It's extremely time consuming to do this, and it really requires someone with a very, very picky sense of aesthetics, because even one drop in the wrong place can be really disastrous. Similarly, with fillers, off-the-shelf fillers, I really like to use, I like using blunt cannulas because there's so much vascularity in the eye that it can be very dangerous to use sharp needles around the eye, so I like to use cannulas. This reduces swelling and bruising in the area. It also reduces any kind of unnecessary trauma to the area. Volume loss is really, unfortunately, indiscriminate, and so sometimes there is a lot of temple volume loss, cheek volume loss, as well as nasal labial folds. Both fat and filler can be injected into those areas for just a general, more youthful look. As we age, we do lose volume in our temples, and nothing is more aging and more skeletal looking than hollow temples. A lot of clients come in and ask me, are you going to make me look like a duck, or am I going to look like a chipmunk? And unfortunately, there's been a lot of overfilling an overusage of fillers. I think the beautiful thing about fillers is I do it with the mirror in my client's hand. And we do a little bit, and then we check. And then we do a little bit more, and we check. And you're the boss. The client is the boss. You tell me when I need to stop. Filler is one of those procedures which is instantaneous result. There really is instant gratification with fillers. What you see in the mirror when the procedure is done is the way it's going to look as you walk out the door and for the next few weeks on end. So one of the great things about fillers is you can walk in, even though you're healthy and you're athletic, if you've got volume loss, you can walk out of here looking healthier and more youthful and refreshed just with a small amount of volume or fillers injected in.
I started noticing things that I didn't really look at before. And then from that's when I came to Lily and said, hey, listen, I have all these spots on that I really never noticed before. Is there something that we can do? Is there, without, really abrasive stuff? And then that's when she told me about the lasers. And I was blown away at how many lasers are out there that can just simply take away little spots here, little spots there, or even to the major stuff. The biggest thing for me is in learning all about the lasers and plastic surgery, I think for me the most important thing is feeling comfortable with the person who's doing it.
And the results are phenomenal with zero downtime. And what this treatment is able to do for patients is take their skin from being dull and wrinkled and very large pores, all these things that we tend to be bothered by with our skin, we can reverse with laser genesis. And it's amazing that we're able to do this with no downtime. We're moving in that direction now where patients don't want downtime. They don't want to be taking 3 or 4 days off work. They want to achieve beautiful skin without the downtime. And that's where laser genesis comes in our practice.
Before I had my eyes done, I'd look in the mirror and see my mother. And then all of a sudden I have Dr. Lily Lee did my tear ducts, and I came out with the most beautiful eyes, and I'm just thrilled. She's made me look younger, and I no longer look like my mother. I have younger eyes that are just delightful. And I'm getting so many compliments on the work that was done. And it was so unexpected that my bottom lids were sort of coming out a little bit, and now they're all tight, and it's just a wonderful new experience for me because I do look a lot younger than I did before the surgery.
So I often get asked, particularly with patients who've been coming into the practice for a while, getting fillers and Botox and laser treatments, when's it going to be time for me to need a facelift? At what point do I need a facelift? And some of that has to do, some of it is a personal choice. Some of it is when you feel like we've exhausted all possibilities of what we can do, or when you're not getting as much of a change from what you want from the non-surgicals. But what a facelift can do is dramatically change, and in a short period of time. One of the reasons why I invited the cameras into my office, I was interviewed by a high school student at my child's school on career day, and she said, "How do you deal with the stigma of plastic surgery?" And it sort of made me think, well, at first I thought, what stigma? But I forget that for me it's a very commonplace thing, and you forget that plastic surgery is a big deal and that it often isn't talked about very much. Because there's so much bad plastic surgery done, when people look done or overdone, it looks unnatural, and I think that's where the stigma comes from. But plastic surgery doesn't have to be like that. In fact, good plastic surgery should not look like anything was ever done. It looks like it's just a restoration or a rejuvenation of yourself. You're still you. You're just more confident when you look in the mirror.